Coming out of a seizure of any kind can be confusing and disorientating, and understanding why and how it happened can be just as fuzzy. Epilepsy is diagnosed to 1 in 200 children in the UK, yet the way in which epilepsy is talked about is still very much left in the dark. To truly understand your epilepsy, it's good to ask questions, especially when you feel unsure, worried, or scared. Seizures are one of the most uncertain things about epilepsy. They're caused by bursts of electrical signals around the brain. Usually, these signals go about their day without any hassle or problem, but sometimes they can jumble messages being sent, causing seizures. Although we're experiencing similar things, we're all different in how our brains work and react, which means our seizures can be different. You may not be aware of what's happening. Things go blank. You may fall over, jerk, flop, or twitch. There may be funny noises, or your eyes may flutter. Or you may daydream. There are sometimes strange little warnings before a seizure, but usually, more commonly, it just happens. For 2/3 of children, there is no known cause for their epilepsy. But you're not alone. Sometimes scary, it's important for your doctors, your nurses, and your parents to know in what ways it can be treated. For most children, their epilepsy is controlled using medicine, and because our brains and bodies are different, it may take some time to find the best medicine to help you. To take a peek at what our brains are doing, doctors can use different machines. An MRI is noisy and dark, and an EEG is uncomfortable and messy, but both can help to figure out the puzzle of you, even if they aren't the best fun. With these fancy machines, doctors and nurses can try and find out what your brain is up to. Without this, it's hard to know what's happening. After these tests, the doctors and nurses can identify what medications are needed, when you should take them, and for how long. These medications can sometimes make you tired, or maybe a little sad or angry. These side effects aren't great, but talking to your doctor, nurses, or parents about it helps, and they can try and find the best medication for you. But it might not be the first one you choose. It can be annoying having to take this medicine, which comes in so many different versions it's hard to keep track. Liquids, tablets, chewable, crushable, and sprinkles. All of them taste and look different. You may find you only like one type. So let your doctor and nurse know which ones work best for you. It's really important to take your medicine, as they're there to help keep your seizures away. Having epilepsy can be confusing and scary, but always remember you are not alone. Talking about why and how it happens can help you and others. You are not alone.